Okay. Welcome everyone to the first Region 1 Planning and Policy Council meeting of 2022. And we're still meeting virtually. We're still hanging in there. Thank you all for taking the time out of your day today to join us. It looks like we have 24 participants on the call, so that's really great. My name's Kirby Fye. I'm with the department, and I just have a few things to go over before we get started. The first thing is, as you can tell, we're continuing to meet virtually, and we're doing so per the Open Meetings Act. When we had a discussion with Regional Council leadership, we decided that with this new highly contagious variant going around, it would just be safer for everyone involved if we continue to meet virtually. And we will touch base again next quarter and make a decision at that time. The top priority is keeping everyone safe, though. So with that being said, per the Open Meetings Act, the call will be recorded and will be posted to the department website within the next day or two. So please keep your phones and or computers muted if you're not speaking, just to prevent any feedback from coming through. And please also state your name when you're presenting, commenting, asking a question is helpful when capturing the minutes. I am going to go ahead now and go through the attendees. I'm going to start with the individuals who have joined via computer because I can see your names, and then I will go back through the individuals who have called in. It looks like we have quite a few individuals who have called in. So like I said, my name is Kirby Fye with the department. I see Jeannie Price, Melissa Birdwell, Elisa Lapolte, Amy Little, Avis Easley with the department, Becky Allen, Valerie Caudle, Daryl Nunley, Caitlin Taylor, Katie McClellan, Kayla Withrow, Kendra Quillen, Christy Tipton. It's on here. Cooper or Cal Bryant, Melanie Eisen, Samantha Slagle, Tim Perry, Wendy Ramsey. I heard earlier on the call when I had just joined, I heard Vonda Wagner. Are you still on the line? I know you had called in.
Yes, I'm here.
Okay, great. If we can go with the individual who called in whose phone ends in 1417. If you could state your name, please. You might have to.
That may be me.
Oh, Amy. Sorry, I just heard a. Okay, sorry. Some individuals have joined via phone and computer. So the phone number ending in 225 is Amy Little. And who was the, okay, sorry. We have one that ends in 4145.
I think that's me. That's Stephanie Bullock and Kim Bowman.
Welcome. And then we have we have an individual that ends in, oh, sorry. Someone must have hung up that is joined via computer. And then we have two individuals that have called in with the last number 6000.
One of them is Christy Blaylock.
Hi, Christy. And who is the other one? 6000 is the last four digits. If you have called in, you might have to unmute yourself. I haven't muted everyone or anything like that, but if you have to unmute, you have to hit *6. Okay, we'll come back around if we need to. All right, Tim and Sam, I'm going to hand it over to you two.
Thank you much, Kirby. Appreciate that. Before we call to order, a couple of things following up on the announcements that are instructions that Kirby gave. We will be taking vote on at least the minutes, and please, we will do that by roll call. So that in the vote, in order for us to record accurately, please state your name and yes or no, or abstain when voting. We may have other things we vote on. I don't know that we will when we get to the needs assessment, but for sure we will be voting on the minutes. The other thing is that if you join, or if you were not called in the original roll call, if you could shoot out a text or put it in the chat box so that we know who is called in or whose name may not have been on the original roll call that we had, so that we can be sure to get your attendance. With all of that, I will call the Region 1 Council meeting to order, and we will start off with the minutes. You should have got a copy of the minutes in 2 attachments. One earlier in last week, it came out with the announcement about the meeting, and then one that went out yesterday as well. So hopefully you've had a chance to look over the minutes from our last meeting. Being trying to find the minutes. In November, I believe it was. So you should have those minutes and had a chance to look over those. Any questions, comments, concerns, corrections to the minutes as they were sent out? If not, then first I will entertain a motion to approve the minutes. Do I hear one?
Sam Slagle, a motion.
Sam Slagle made the motion to approve. Do I hear a second?
I'll second.
Sorry, who was that?
Christy Tipton.
Christy
I'll
Tipton
second.
seconded. Thank you, Christy. Christy Tipton seconded the motion. But this time we'll take a vote on the minutes, and either Kirby or Kayla, if you'll run down the roll, or yes or no on the minutes.
I can run down the roll. Melissa, yes, no, or abstain.
This is Melissa, yes.
Okay. Kirby, yes, no, or abstain.
I have to abstain.
Sorry, my computer's still frozen up with the roll that I've taken. Valerie, yes, no, or abstain.
Yes.
Okay. Daryl, yes, no, or abstain. Thank you. Tim, yes, no, or abstain.
Yes.
Okay. Becky Allen, yes, no, or abstain.
Yes.
Amy Little, yes, no, or abstain. Melanie Eisen, yes, no, or abstain.
Yes.
Okay. Christy Blalock, yes, no, or abstain.
Yes.
Okay. Avis Easley, yes, no, or abstain.
Abstain.
Okay. Kubra Akral Bryant, yes, no, or abstain.
Abstain.
Okay. Katie McClellan, yes, no, or abstain. Kendra Quillen, yes, no, or abstain. Caitlin Taylor, yes, no, or abstain.
Abstain.
Okay. Stephanie Bullock, yes, no, or abstain.
Yes.
Okay. Kim Bowman, yes, no, or abstain?
Abstain.
Okay. Elisa LaPolt, yes, no, or abstain?
Yes.
Jeannie Price, yes, no, or abstain?
Yes.
Wendy Ramsey, yes, no, or abstain?
Yes.
Vonda Wagner, yes, no, or abstain?
Yes.
Okay, did I miss anyone that was not able to vote?
Jim Broheimer.
Okay, I think that may be everyone, Kirby.
Okay, can you just tell me what the total numbers, the total for yes and abstain were? And then we can move forward.
Yes, give me just a second.
Hello, Michael. Hey. No, I'm on a car.
Just a reminder, please put your mics on mute. If you're on a computer or phone, please put your mics on mute so we don't get background noise. Thank you.
It looks like I have 7 yeses and 5 abstains.
Okay.
Thank you, Kayla. Thanks for a vote. All right, moving on, then the minutes will stand approved. Old business. First item on the old business, of course, is a reminder that that we are still looking for enrollment, taking enrollment. If you're interested or know someone that would like to be a member of the council, please reach out for a membership application from Kayla. We'd be happy to provide that to you. Previous meetings, we had discussed having representation from our area colleges or universities, and we would like to continue working toward that initiative. So if you know someone representing one of our colleges or universities that would like to become a member of the council, please reach out to them and let us know and let them know how to apply. We'd love to have some representation. We are very active with our colleges and universities, and now during this workforce shortage time, it's even more imperative that we engage them in communication with what's going on through area providers as well as state. So it would be beneficial for us and them to be part of these kinds of meetings. So again, please reach out to them and let us know, or if you know someone that you think would like to be a member, let me know, or Kayla and or Sam, and we'd be glad to reach out to them ourselves and just invite them to become a member of the council. Any other old business that needs to come back before the council before we move on? Any other old business? If not, then we'll move on to the new business, and the main primary topic of new business for the council today is around the needs assessment. As we have heard, the last meeting we had, the needs assessment, it's time for us to be developing that now. And we've had discussions since beginning back in November, December with the 2 primary subcommittees, adult and children's committees, to begin engaging members around the needs assessment. We've also reviewed what was our needs assessment from last year and taken a look at that and progress that has been made and steps toward meeting those needs statewide and regionally as we have developed the needs assessment going forward. We also, as we're made aware, Kirby made this announcement to us last time, that there has been additions, opportunities to add to our needs assessment. Previously, it was 2 mental health and 2 substance abuse needs that we could submit And that has been increased by one each, so that we now have 3 mental health needs and 3 substance abuse needs that we are able to submit to the department for each region. The issue with that we need to be mindful of is that they need to be equal. In other words, we cannot have more mental health than substance abuse, but they need to have equal representation, so that if we have 3 mental health needs, we also need to have 3 substance abuse needs. Again, we don't have to have 3, but 3 is what we are allowed to present for each region for our needs assessment. As typical historically with Region 1, the way that we have done these is our primary subcommittees, which is the adult subcommittee and the children's subcommittee, would break out, and then they would look at needs relevant to the population for that subcommittee, adults or kids. And then they would come back with a report to the full council of what they recommend to be the needs for the council. And then the council would have feedback in full to at that meeting to determine what they wanted to put forward as representing the needs for this region. And then we would go forward with that. Each of the needs also has to be supported by data that's relevant to that need and necessarily specific to our region, so that we do research to show the support for that need. Need can continue from one year to the next if that need is still present and if that need is still relevant in the area, and there is data to support the need is still there for that particular region. So with all of that kind of being said and set the stage for our needs assessment, Kirby, anything you want to add to that, or anything you want to say before I turn it over to our subcommittees?
No, you did great. You covered everything I had listed.
All right, very good. So at this time then, I'm going to turn this over to the subcommittees, and again, to give their report. As was mentioned, or as we will mention, we may not have a full report from each committee for recommendations at this time, but if so, they will give that, or they will give an update on where they are in planning around the needs assessment. So at this time, I'll turn it over to the adult subcommittee chair, which is Sam Slagle. So Sam, take it from here.
Well, Tim, thank you, sir. You wrapped that up in a nice little package, and I'm not real sure what to do with it, sir. You know, this process is kind of hard enough when we do this in person over the years that I've done it that way. Last year, there wasn't a fraction of the members present when we were doing this part, so we were very left to our own devices last year. I know that we'd sent out the email saying, hey, if anybody has any kind of input, go ahead and reach out, and I didn't hear from anybody. So as far as quote presenting, I don't have our needs sort of outlined yet, and I don't know if Kirby or anybody has a suggestion with this many heads how we might go about that. I will say that last year the adult team, or the adult side, put forth our mental health goal was based on the workforce crisis, and we were very specific, though. We were talking about licensed behavioral health professionals in our region that can work with everybody, kids, adults, and everybody. So that was our mental health need, was based on that workforce shortage. We all know that we have the task force on that, and we've had some movement, and there's some things happening there. So I don't know if we want to discuss leaving kind of that as our boat this year, or coming up with an additional one. In addition to that, the substance abuse one that we put forth last year, always going back to this was more specific for recovery and transitional housing for folks with substance use disorders. So with that said, and we're not necessarily, I don't know if convening as an adult committee at another time, I would be a little afraid that I wouldn't be able to collect everybody. So I don't know if we want to spend a few moments discussing what people's ideas are, Tim, or how we want to handle that at the moment.
Well, Sam, we can go either way with this. Either one, we can have a separate meeting that you can set at a set time and a date, and ask for members of the adult committee to meet at that time virtually, and have a meeting that way, and then take a email vote to the full council, or after you have those recommendations that you could send out and get a vote back. Or we can open the floor up to discussion, and I'm open to that as well. So however you feel like would be best for the adult committee to address the needs.
Well, if we could take about 15 minutes, I'd like to see what happens. My concern about doing breakout group is I'm not going to get very many heads if I try to do an additional meeting. We're all so busy. So, and guys, we all generally know in years past, it's been transportation and housing. We've made some progress on those things. And we all deal with generally, I know that we're adults and children here, but most of us all deal with adults in one way or the other. So what are y'all's thoughts? And let's sort of be boisterous about this and not be meek, because we got 15 minutes to kind of get to the root of this. And in our region, what are you guys seeing right now is kind of the two biggies in, I guess, mental health. Any ideas?
This is Amy
I
Little.
can see.
Housing
Yes,
and
Amy.
transportation are still both huge issues.
Okay. Any specifics on the housing? Any specific group, or just housing in general?
Sam, I know
Sam?
in my neck of the woods, we continue to struggle with recovery housing. So that next step after rehab.
Okay. I had spoke to some people in the A&D community, and they spoke specifically about housing for medicated assisted recovery persons, because they are not allowed in any of the housing programs. Transportation is also an issue, but I think it's not as big an issue at the moment probably as the housing for those MAR folks specifically. So I
Absolutely.
think
We are
when we
seeing
get
that a
to the
lot.
substance abuse, okay.
Absolutely.
And when you say recovery housing, there's still a large need in general in the recovery world, but in addition to that, we've got the medicated assisted group that's in a bucket all of their own. Okay.
Yes, absolutely.
All right. Other thoughts?
Yeah, I would say in Greenville, what we're seeing is an increase in homelessness, and especially people who are released from jail. And I think there's a need for more focus on reentry.
Can you be a little more like what?
Sure.
specifics
So
on the reentry?
reentry programs for people who have been incarcerated, giving them the skills and resources they need to integrate back into the real world, how to, stay in recovery. And I mean, I know the governor had invested a lot of money in the legislature in these kind of programs, job training, and then there's a housing component as well, because a lot of these people have no place to go because they've burned bridges with their family and friends. So.
Okay. Thank you for that.
Mm-hmm.
This is Kayla Withrow. I'm usually on the CNY side of things, but for an adult need that I think could definitely use some attention is harm reduction strategies for those who aren't yet in recovery. So better access to clean needles, testing strips, safe spaces to use that have access to recovery outlets when they're ready for that, to reduce the amount of overdoses and bring down some of the stigma around substance use.
Okay, thank you, Kayla.
Jim Broheimer?
Hey, Jim.
Hi. My population, we've got difficulty with the cost of housing, and for people with a negative background check, there needs to be some degree of flexibility or understanding for that. Thanks.
Is this HUD specific stuff, Jim, or is it just housing in general?
Well, primarily HUD, but it generalizes across the field. So once they see a negative background, they're locked out, even if they could afford the place.
Thank you, Jim.
Sure.
What else? Okay. I haven't heard anybody say anything about the workforce initiative. Do we feel like there's momentum there and that already has as much as resources that we can throw at it, and we want to kind of change our focus, or do we want to leave that on there for another season?
I think that'll probably be taken up. I haven't looked at the governor's budget yet. He gave his state of the state last night. I'm assuming that it's going to be included in that, and that's something we'll be pushing for during the legislative session. It might be good just to show a united front that is a need. But if we want to reserve space for another item since it's moving ahead, that's a strategy also.
Okay. Well, gang, this is what I have so far. And I guess for the adult side, I'm going to sort of fluff out 2 of each. I'm not going to step to that 3rd level because I'm not hearing 3 of each. I'm not hearing that we're presenting a lot of additional needs. So what I'm having sort of as our ideas is for the substance abuse piece, housing, but more specific. And I wonder, I'm thinking in these goals, it needs to sort of be siloed. You know, I could put recovery housing, but I'm afraid if I just put recovery housing, we're going to leave out those MAR folks. So I'm going to go MAR specific instead of recovery, because I do think there's a force going for the recovery. Unless we can talk that out. And then harm reduction as our second. And then for mental health, housing in general, and then the workforce crisis. So if those kind of 4 items sound like what we want to roll with, Kirby, I don't know if this is when we would take a vote. Does anybody have any additional ideas? And if that's how it works, we take a vote and then we go ahead and fluff it out. But these are kind of our concrete ideas of what we're going to work on.
Sam, let me say this. I would, and Kirby can give us feedback here, but I really think we would vote on the whole needs assessment. So this would just be the adult piece. We haven't heard from CNY yet. I'd like to hear from CNY. Now, if you're going with 2 mental health and 2 substance abuse, in adult, then remember 6 is what we have. I mean, so we'd have to narrow down with. Is that what you're saying? I'm not sure I heard that.
Well, I think the first year I did it, I had to get 4 ready, and then we only picked 2 out of it. So if you know, I'm hearing more so I can do 1 and 1, and they both are going to be housing. The mental health one would be housing, and the substance abuse one would additionally be that MAR housing. If people feel like that covers what we're hearing for the adult, the largest adult need. And that would be fine if we just did 1 and 1, and then we can re-vote once we get all the data together. That's perfect. I just didn't want to get data together if this is not the direction we're going.
Do we have any other feedback on this?
Yeah, this is Kayla Withrow. Sam, I think if we brought it back, so Melissa and I are going to be meeting today at 1, and then hopefully also setting up some space for others to meet with us for more planning and more ideas. So we don't have our needs set yet either. I know that we're definitely going to be targeting the workforce because, like Alyssa or Lisa was saying, that's still very important. We're seeing progress there, but we don't want to let go of that yet. So it's also possible that some of our needs are going to overlap, and we can just kind of tag team that data point. So if you still want to have those 2 and 2, it's possible that we're going to have some overlap there with those. Maybe not so much for the substance use, but for the mental health, we might see a lot of overlap.
Sounds great. So with all that said, then, is there any other adult concepts that we need to consider before we kind of close up our side? Does anybody specifically have any passion about the MAR housing or the general housing and have access to some really wonderful data that would like to help build these? All right. I think that's all for the adult side, Tim.
Thank you, Sam. I know, Kayla, you had mentioned that the CNY subcommittee has got a date and time to convene to discuss needs. If you want to share that, and if you want to take this time, the next 10 or 15 minutes, to get feedback from the rest of the council around needs for children's services, then please feel free to do so. So I'm going to kick it over to you, Kayla.
Yes, so Melissa and I are meeting via Zoom today at 1. That does not have to be the only time that we meet. I think a big part of our meeting today is going to be just trying to set a date that we can send out. We had some great feedback and participation last year, so I'd like to reach out to those same people. And then Christy Tipton, I would also love to have someone from Crisis there, so we could also look at the increase in crisis services for CNY. I'm also curious to get data points for transitional housing for our youth who are transitioning either from foster care or being kicked out of their homes at 18. And I'm not sure if that's too much in the adult side of things or if it still falls into the children and youth side of things. So those are some data points that I'm interested in looking at. But let me hear some feedback from you guys.
Crisis will be happy to be a part of that. Just let us know what you need.
Thank you, Christy. I'll email you.
I'm opening the floor up, Kayla, appreciate that. Open the floor up to the rest of the council members to give feedback now to Kayla and Melissa regarding children's needs that you may think should be something discussed when they convene as a subcommittee.
Question two, would you like me to put the Zoom number, the ID, in the chat box and people can join at 1 o'clock today if they happen to be free?
I'm fine with that. I think that'd probably be a good idea. Thank you,
Okay,
Melissa.
I'm gonna go ahead and add that.
Okay. Again, anybody have any feedback to this committee regarding needs like we just did with adult that you would like to have the subcommittee take thought of and consider?
Hi, this is Melanie Eisen, Sullivan County Anti-Drug Coalition. One of the things that I've come across the last few months is folks looking for detox for youth and inpatient, and they've not been able to find that locally. They've had to travel across the state, so that seems to be a need that I keep coming across.
Thank you, Melanie.
Thank you.
I have it.
Other thoughts around children's needs and children's services for Region 1 to share? All right, then. The subcommittee will meet today at 1, and the Zoom information should be in the chat box. And feel free to join in with that. And there may be a subsequent meeting to that meeting. Now, Kayla, how do you want to present this information out? Do you want this to come out from you and Sam in an email that would be shared with the full council so that a vote can be taken via email? Or how would you like to handle that, you and Sam?
So, Sam, I would definitely like to email with you and pin down some dates when we both want to have all of our topics presented. And then I think an email vote would be helpful. So, as long as you and I have a date that, like, hey, our subcommittees have met by this time, we've given space for everyone to come forward and talk about what they think the needs are, we could present what we've come up with, send it out together, and have a vote. But my understanding is at least one in each section needs to be CNY or adult. Like, it can't be 3 adult substance use and 3 CNY mental health, right? Is that
There's no, sorry, this is Kirby. So the only conditions really is that there has to be equal representation of mental health and equal representation of substance abuse. As far as children and adult goes, there's no requirement there. It's really whatever the needs are in your region and what you decide on.
okay? Okay, so yeah, if we can just send out an email for everyone to vote on once Sam has her committee ideas together and Melissa and I have our committee ideas together.
All right, then, and Kirby, correct me, I am correct that they can do that by email vote of the full council once it's presented to the whole council. Is that correct?
That's correct. We just need to make sure that we tally up the number of individuals that have said yes, so that we know that there's a majority there, and that we address it at our next meeting, which is in May. That just states, you know, this is what happened in between the last 2 meetings, and this is what we voted on.
Correct. Correct. All right, then. Any other feedback from anybody that's on this meeting regarding needs, whether they are adult or children's? Take opportunity to share that now. So the floor is open to anyone that has any other thoughts or ideas regarding needs for Region 1. All right, then, if not, please send any feedback to Sam or to Kayla. And if you possible can join with the CNY meeting via Zoom, please do so and provide them any feedback regarding what you consider might be needs for us to look at for Region 1. And then we will take vote once that is fully compiled as a full council via email, and we'll report back out on that at the next meeting in May. Anything else before we move on? All right, then. Any other new business? Do we have any other new business that needs to be brought before the council before we go on to reports? All right, if not, I do want to say thank you to Sam and Kayla and the feedback that they've received from the council members for pulling this together regarding our needs assessment. It's been good feedback. We look forward to hearing what others have thoughts on regarding the needs for Region 1. Forward to hearing more about that. So thank you all, and thank you, Sam and Kayla, for pulling this together. We will now move on to reports. And we'll start out with reports from our adult committee. Sam?
I don't have anything to report.
Okay, no report from adult. CNY subcommittee, Kayla?
No reports other than just getting our needs assessment together right now.
Thank you. Legislative committee, we did not meet this time because the needs assessment subcommittees were meeting, but is there any information from any of the members of this legislative subcommittee that would like to report out at this time? All right, then we'll take that as no report information on the legislative committee. Anyone with the MCOs present that would like to report out?
Hello, this is Kubra. I'm with United Healthcare Community Plan. I don't have anything to report, but we are going to be around for a while. So I'm still sponsoring and supporting events that's happening in the communities. Please reach out to me when you're organizing events, when you need help. I can help you plan them as well as provide other kind of help, financial and other help. So let me know. We're still here.
Thank you, Kubra. I appreciate that so much. Any other MCOs that are on the call or on the Zoom that would like to, on the meeting rather, would like to comment? Or all right, and Kubra, I do want to say thank you. You seem to be the most consistent member of the managed care organizations that are on these meetings. We appreciate you and thank you for being here.
Pleasure to be here.
All right, any inpatient facilities? Any inpatient? Not any update on crisis, Christy or CSU?
Yes, I'll talk about crisis and a little bit of inpatient together, I guess. We're not necessarily considered inpatient, but do a lot of those things. Crisis since the first of the year has been very, very busy. A lot of folks coming in with some co-occurring substance abuse, but in a lot of depression, which we often see after the holidays. But it's very busy. We a couple of months ago we moved our detox unit over to our Mag Ridge for the men. Just with COVID and staffing, it just was a good move for us, and it's been really great for our clients because they get to attend the residential groups and participate in the residential program while they're detoxing. And a lot of them end up wanting to stay the 28 days and make progress towards their recovery that way. So that's been really awesome to see. So we're definitely seeing some good things come out of that. The women are still detoxing on CSU, but we have set up for them to, if their goal is to go to Willow Ridge, to be able to do groups via Zoom with Willow. So that's been a really great thing. But Celeste is kind of doing the mobile and the crisis world now, but walk-in has been very busy. And I know our crisis calls have been up, particularly with kids. We're starting to see an increase with kids already, with them going back to school in January. So walk-in center for kids and adults is staying pretty steady. One thing that Celeste is working on with the crisis realm, of course, is the 988, the suicide prevention calls that we're getting now, getting all the way to Roanoke and then past Knoxville. So triage is staying very, very busy with our normal crisis call volume, and then our suicide prevention calls. I've heard of a lot of live rescues that they've done, so they're doing a really great job with that. So I think that's all I have. It's just the usual crazy busy around here. So we just keep on trucking.
Thank you, Christy. Appreciate you. Hats off to Crisis. They've done an amazing job. Anyone from Youth Villages on the meeting? All right. NAMI. Any report from NAMI?
Yes. Hi, everybody. We are very excited to have on our staff now a full-time person for East Tennessee that's going to help us grow the CIT program, our Crisis Intervention Team program for law enforcement training and community coalition building around law enforcement resources for people with in a mental health crisis. I'm even more excited to announce that Greenville Police Department has engaged us into forming a CIT program there. So this is hot off the press news, and we just met with them last week. And my role in all this is to help them build a coalition of stakeholders. And if you all are interested in sitting on that coalition, it's going to be meeting monthly. And I would like to have any names, recommendations. I've reached out to Ginger at Frontier. She actually sits on our NAMI Tennessee board and thought that might be a good fit. But please let me know if there's anybody who you think would be a good fit to sit on that coalition in Greenville. So thank you. Oh wait, I do have one more
Thank
thing.
you,
I'm
Elise.
sorry. I do have one more thing. Our advocacy days, we're not calling it Days on the Hill because we're not going to be on the Hill because of COVID, but it's going to be March 1st and March 2nd. And we're going to have Commissioner Williams speak on March 1st. And then March 2nd is going to be our advocacy training. And I'm happy to send you information. So sorry. Thanks.
Thank you, Elisa. Both of those are exciting. I'm really excited to hear that about Greenville. That's something I know that we've been hoping will happen in a long time. So it's great to see that in motion now. And certainly we do want to support coalition. So we will get the word out and get back with you about that. Thank you. Community justice. Anyone? Community justice. All right. Anyone from TCCY? I think they do have a training coming up, but I'm not exactly sure when. I believe it's on building strong brains. ADRC. TSPN. TDMHSAS. Anything on disability rights?
Hi, this is Becky Allen. I just wanted a brief report just to let everyone know that our children and youth team, as well as our adult team, are really focusing their efforts and have been really throughout the time of COVID on doing investigations and monitorings in facilities across the state. Just in recent months, they have visited, spent days at all of the regional mental health institutes, talking with staff and individuals as well, and reporting back on any concerns that they're seeing to work toward resolving those. Our children and youth team is also doing a lot of work in those facility settings, those congregate settings, working with the youth and working towards resolving issues that they're seeing. So those are some of the big things that have been going on, and those are continuing to go on. That is a major focus of both of those teams at our agency.
Thank you, Becky. Appreciate that. And I know that's a very concerted effort to try to make sure that folks are getting their needs met. Moving on, Lifeline. Anything from Lifeline?
This is Daryl Nunley. The only thing that we've been actually doing here recently is starting a faith-based meeting in the CSU unit at Mag Ridge. Other than that, we've kind of slowed down because of the COVID. Hopefully it'll pick right back up and we'll be able to. And I'm very interested in getting with Elisa on that coalition in Greenville, because that's part of Lifeline's area. So I'm looking forward to that. That's all I have.
Thank you, Daryl. Appreciate that. And I know Lisa appreciates the support for the coalition too. Thank you. Housing, do we have anything on housing? Jenny, anything to report?
Stephanie Bullock's there, I think.
Hey, I'm here. We actually just had some funding announcements that came down through the pike. I don't have all of them in front of me, but I know that our area did receive 2 awards, one for mental health housing and the other one for recovery housing. I just don't have the dollar amounts in front of me, but we were the recipients of 2 awards.
Congratulations.
Thank you. We're excited.
Thank you, Stephanie.
This is Wendy. We're also waiting to hear on the possibility of funding for the reentry population. We have a couple community partners who have applied, so anytime we should be hearing information on that. Hopefully, good news.
That is great. Thank you, Wendy. Fingers crossed for you. Anything else on housing? Yeah, okay. Any other providers that are on the meeting that would like to report out? I will make mention of this, and I don't know if this was mentioned in our last meeting back in November or not, but that Frontier Health was the recipient of the Tennessee Resiliency Project Grant Award that actually goes into effect today, starting February the 1st, which will allow us funding, a nice piece of funding. It's across the state, about 6.1 million statewide. And that will be to allow us expanding school-based services, project basic services, which is early childhood, kindergarten through 3rd grade, as well as some integrated care work in some of our primary care medical clinics across the region. So we are excited about the funding that we receive for that and the opportunity to expand even more of our services for children and families. Any other reports or announcements from any of our providers before we go on to the department? All right, then at this time, I'll turn it over to Kirby or Avis for them to report back on the department. So Kirby, I'll turn to you.
Sure, thanks, Tim. All right, let me pull up my update. So just a few things to go over since we last met in November. The first one, we've talked about the majority of this meeting, but just a reminder that the 2022 needs assessment worksheets are due to me on or before April 1st, 2022. And to also remember that we have the Fast Facts portal on the department website. That's a tool there. It's not required to be used when selecting data to support your identified needs. It's just there's a tool. You can use any data that you find as long as it's relevant to your need. And you want to make sure it's within the recent years as well. So just there's a tool. Just wanted to remind you all. The FY21 joint annual report is complete and it's been posted to the department website. I've included the link here in my update that I'll share with Kayla, and she'll include in the minutes to share with you all. But I encourage you to take a look at it if you can. It highlights a lot of the accomplishments that the department has experienced over the past fiscal year, as well as regional council accomplishments as well. So if you have the time, I encourage you to take a look at it. The department has selected a total of 10 programs across the state to receive $6.5 million in new funding to expand mental health services for children and youth. The new state funding was budgeted by Governor Lee and appropriated by the Tennessee General Assembly in the department's budget for state fiscal year 2022. In the department's announcement of funding, grantees were instructed to collaborate with community stakeholders, including local education authorities and other partners, to design proposals that would have the greatest impact and address outstanding needs. The selected proposals increase school-based services and respond to the increasing need for emergency psychiatric services for children and youth. Available funding under this announcement was divided proportionally among the department's 7 planning regions based on the number of children and youth living in each region. So I've included all 7 regions in my update, but I'm only going to report on Region 1. If you're interested in seeing the other regions, it's included in my department update. So Region 1, Northeast Tennessee Frontier Health, $424,000 to expand school-based services through the School-Based Behavioral Health Liaison Program and Project Basic, enhancing crisis care with an additional master's level therapist. In December 2021, the department and TennCare published the Public Behavioral Health Workforce Work Group Report. The document contains research, data, and strategies for addressing workforce challenges in publicly funded mental health and substance use services, some of which have already been translated into state budget requests proposed to Governor Lee. Convened by the department and TennCare over the summer, the work group was comprised of diverse stakeholders from public behavioral health provider organizations, mental health and addiction advocacy groups, colleges and universities, and the department's statewide planning and policy council. Over the course of 3 meetings, participants identified gaps and needs in the public behavioral health workforce, developed detailed strategies for creating positive change, and authored the report for key decision makers. The report's recommendations focus on several key areas of impact, including provider reimbursement rates, licensure modifications, employee benefits and incentives, pipeline career planning, diversity and inclusion, student loan forgiveness, expanding internship opportunities, and communicating to potential students. Budget proposals from both the department and TennCare reflected high priority items from the workgroup report, including increased funding to allow providers to pay more competitive wages, sign-on bonuses, post-secondary scholarships, and internship opportunities. In all, the agencies proposed $59 million in new state and federal funding to address these issues contained in the workgroup's findings. I've also included a link to this public behavioral health workforce workgroup report, and I encourage you to take a look at it if you have the time. And last but not least, the Tennessee Recovery Navigators are celebrating another successful year of delivering life-changing interventions for individuals living with addiction. The department released a new annual report which details the program's successes despite a full year of pandemic-related restrictions. Tennessee Recovery Navigators use their own personal experience of addiction recovery to talk with patients at Tennessee hospital emergency departments and try to connect them with treatment resources. The patients they see have recently overdosed, are experiencing active withdrawals, or have presented with a substance use disorder. The new annual report details accomplishments for fiscal year 2021, including increased patient interactions of 2,967. 76% of patients were placed into treatment, and 4 hospitals were added to the program for a total of 42. Now in their 4th year, the Tennessee Recovery Navigators have worked with more than 6,700 patients statewide. And some of the program's earliest patients are in recovery themselves and are working in behavioral health, as detailed in a video that was produced by the department that you can find on our department website, and I've included a link to that as well. And that is what I have.
Thank you, Kirby. Appreciate that. Any other reports or information to share with the council from anyone? All right. I don't hear anybody saying anything. So again, please, a reminder that the adult and CNY subcommittees are meeting to finalize the needs assessment and pull that information together to bring back to the council via email and report to recommend and get voted in as our needs assessment. So be on the lookout for that. Please watch your emails. If you have opportunity to give feedback to Sam or Kayla, to the committees, please feel free and encourage you to do so that they have this information collectively and can look at it as committees to determine what they feel is the most relevant needs for our area that we want to present for our needs assessment. Any other final comments from anyone before we move to adjourn the meeting? All right, again, I want to thank you for being participant on today's meeting. Appreciate the department and Kirby for helping set up this Microsoft Teams meeting platform. Appreciate those who gave feedback and being on the call and being on this meeting. I do appreciate you very much. Encourage you to continue reaching out to people who may want to become members of the council, and the process for doing that through the application that would go to Kayla. Please encourage them to do so. We are continuing to want to expand our membership reach for the council. At this time, then, I will entertain a motion to adjourn. Do I hear one?
Daryl Nunley, motion to adjourn.
Thank you, Daryl. Daryl has made the motion to adjourn. Do I hear a second?
This is
Melissa
Kayla.
second.
I think I heard Melissa and I heard Sam.
I've got you down, Sam.
I'll do it
right.
next.
Okay, thank you. All right, we do not need to vote on adjournment, but we have a motion and a second. At this time, our meeting is adjourned. Our next meeting is Tuesday, May the 10th. Again, that's Tuesday, May the 10th, 10 a.m. our time. And at this time, we'll still be looking at virtual. If that changes, of course, you will be notified well in advance. Thank you, everyone. Have a blessed rest of the day and rest of the week. Look forward to hearing from you and seeing you next time we meet. Goodbye, everybody. Thank you so much.
Tim. Bye.
Hi, everyone.
Bye, Kobe.